Welcome to Pharma Drama, the channel where we look at the science of healthcare and healthcare products. As you might know, I make my UCL lectures freely available, and this is a lecture I deliver on one of our MSc programs. So, if you're one of our UCL students, welcome, you've clicked on the right link. If you're not at UCL, also welcome. You can watch the lecture without fear of an exam at the end. Today, I will explain a new type of manufacturing that has the potential to change the face of medicine, 3D printing. I'm sure you've heard of 3D printing or read about some of the amazing things that have been 3D printed. Organs, body parts, guns. Although I have to be clear that in the UK at least, it is absolutely illegal to print any part of a gun. So please don't even go there. While we are not quite at the level of printing new body parts in pharmaceutics yet, I can tell you that 3D printing is revolutionising the types of drug delivery systems we can make, and is allowing us to personalise medicines to individual patients. In this lecture, I will introduce the types of printing that are most widely used in the design of medicines, including inkjet printing as well as 3D printing, and look briefly at some of the applications of each. We will have regular coffee breaks, but I see no reason not to start without a coffee, and I recommend you get a drink too. Then when you're ready, press print and let's make a start. As ever, let's start with today's learning objectives, which are shown on the screen in front of you. By the end of the lecture, you should be able to describe the operating principles of a number of printing technologies. I'm going to start by looking at inkjet printing. So by the end, you should have a good appreciation of the two designs of inkjet printer. And then I will cover 4 types of 3D printing technologies: powder bed, fused-filament, stereolithography, and selective laser sintering. In all cases, you should be able to discuss how these printers work, what type of material they can print, and their advantages and limitations. We will also discuss some pharmaceutical applications of each, so you should be able to give examples of their medical use also. In each case, I will provide links to research papers that you can read to see the original research. And of course, you are free to find your own research papers, because printing medicines is a very big field right now. I also give lectures on 3D printing in other modules. If you are not taking these modules, but you're interested in the material, you can, of course, watch them on Pharma Drama. There are 2 basic types of printing that we will discuss: inkjet printing and 3D printing. I think it's easiest to begin with inkjet printing because you are probably familiar with it. Unless you have a laser printer, your desktop printer will work by inkjet printing. You have probably never thought of just what a marvel of engineering your printer is. But I can tell you that a typical inkjet printer can produce up to 10,000 droplets of ink per second, each with a volume of only 2 to 4 picolitres. That's very small. 1 picolitre is 1 trillionth of a litre. To put that into some sort of perspective, a 2 picolitre droplet is about the same size as 200 red blood cells. The printer jets droplets from a number of colour cartridges, usually 3, and it deposits these on a piece of paper with exquisite precision. So think to yourself, if a cheap desktop printer has the ability to reproduce an image like this, imagine its potential in printing medicines. If you buy a desktop inkjet printer, it will operate on one of 2 principles: thermal inkjetting or piezoelectric printing. Broadly speaking, if you buy a printer made by Hewlett-Packard or Canon, it will be a thermal inkjet printer, and if you buy one from anyone else, it will be a piezoelectric printer. We tend to use HP printers because the cartridges they contain, you can see examples on the screen, contain both the reservoir of ink, or several reservoirs if it's a colour cartridge, and the printhead itself. This means that if you modify the cartridge so that it's printing something other than ink, a solution of drug for instance, and you block the nozzle, you don't have to throw the whole thing away. you can just swap out the cartridge. A typical piezoelectric printer usually has cartridges that contain only ink. The printhead itself is part of the printer hardware, and so these are harder to modify because if you block the printhead, you have to work out a way of cleaning it. Let's look at how these printheads actually produce droplets. On the screen in front of you is a schematic representation of a thermal inkjet printer cartridge. At the top is a reservoir of ink, which is in reality surprisingly small, around 1 to 2 mils for the printers that we use, which sits above a capillary. The capillary leads directly to the nozzle from which the droplets are ejected. On the side of the capillary is a heating element, shown in red. The element is just a resistor through which an electrical current can be passed. As a current passes through the resistor, it heats up, much like how an electric toaster heats bread. In a typical inkjet printer, the temperature at the surface of the heating element can reach up to 300 degrees centigrade. Although that seems very hot, the rise in temperature is very quick, and in practice the ink solution doesn't usually get hotter than around 40 degrees centigrade, which is why it's possible to use this type of printer with pharmaceuticals and biologics. The high temperature causes any dissolved gas in the ink solution to vaporize, forming a bubble. As the bubble grows, it starts to displace the ink in the capillary. The ink cannot move upwards because of the weight of the remaining ink in the reservoir, so it's forced to move down and is ejected from the capillary as a droplet. As the liquid leaves and the bubble collapses, a partial vacuum is created, which draws liquid down from the reservoir, and the process repeats, creating multiple droplets. This type of printing is known as drop-on-demand, because one droplet is produced for each cycle of current passed through the resistor. It is also why Canon calls its printing technology bubblejet, because it's the bubbles that are creating the droplets. Piezoelectric printers work slightly differently. A schematic of a piezoelectric printhead is shown on the screen in front of you. At first glance, the image is identical to that of the thermal inkjet printer we just discussed, and indeed they are very similar. The only difference is in how the droplets are produced. In this case, instead of heating elements beside the capillary, there are quartz crystals. Quartz crystals have the peculiar property of vibrating when an electric current is passed through them. This is why they are used in wristwatches, as the vibration is the basis of keeping time. In a printer, as a current is passed through the crystal, it expands and slightly compresses the walls of the capillary. This has the effect of reducing the volume within the capillary, so the liquid within is forced to move. As we just discussed, the ink cannot move upwards because of the weight of the remaining ink in the reservoir, so it's forced to move down and is ejected from the capillary as a droplet. As the crystal returns to its original state, the volume in the capillary increases, creating a partial vacuum, which draws the liquid down from the reservoir, and the process repeats, creating multiple droplets. As you might have guessed, this is also a type of drop-on-demand printing. Although similar, in most respects, the two technologies are suited to slightly different solvent systems. Because the temperature rise in a thermal inkjet printer can be high, it is more suited to printing aqueous solutions because they won't boil and their high surface tension needs a considerable mechanical force to overcome. Piezoelectric printers, conversely, are more suited to organic solvents because there is no rise in temperature and little surface tension to overcome, although they can print aqueous solutions too. In either case, the waveform of the electric current passing through the printhead defines the size of the droplet produced. It's really important to match the properties of the ink to the waveform used in the printhead. Obviously, when you buy a desktop printer, you don't have the ability to change the printing waveform, so you need to match the properties of the solution you want to print to those of the ink it originally contained. If you buy a research grade printer, and we have a very expensive piezoelectric system in the lab, then you can vary the waveform to any solution you want to print. We are limited only by the size of any particles in the solutions we print. It is very easy to block the nozzle. You might think inkjet printers are not used on a commercial scale, but you'd be wrong. It's easily possible to scale up inkjet printers either by having a larger print head and reservoir and or increasing the number of printers. I've visited a company that uses inkjet printers to print wood patterns onto doors, for instance, and inkjetting has many commercial applications, including to add use-by dates to fragile foodstuffs. Now, how did my own research group start researching pharmaceutical applications of inkjet printing? I know you're dying to ask. It all started when I saw a talk at a conference where inkjetting was used to create microparticles. I thought, what a good idea, and cheap too, and that's the best kind of science. So I popped down to the nearest Argos, Chancery Lane I believe, and bought a Hewlett-Packard printer. It cost all of £29.99, and they tried to sell me a 5-year warranty for a further £30. I won't be needing that, I thought, principally because within 10 minutes of being back in the lab, I had taken a hacksaw to the cartridges and sawed the tops off, as you can see in the middle picture on the screen. This had the effect of immediately invalidating the warranty. Then I removed the ink. Surprisingly, most of it is contained in a small cube of sponge. Rinsed the cartridge with ethanol and blow dried it. After that, all I had to do was put some water in it, clamp the cartridge back in the printer. Luckily, the HP system clamps the lids onto the cartridges, and press print. To my absolute surprise, it worked perfectly. And that was very lucky, as it turned out, because, as I noted earlier, you normally have to match the waveform of the printer to the ink. But in this case, the HP ink was almost all water, so it printed fine. Remember, also as I noted earlier, that with an HP system, if you damage the cartridge beyond repair, you can just get a new one. No need to buy a new printer. Knowing that the printer worked, I had 2 excellent PhD students use them to develop medicines. On the left of the screen, you can see the results from one of them, who was tasked with printing polymer films containing drugs. The films are tinted green, so you can see them in the photos, by the way. We didn't actually think green films were a good idea. You might say to me, surely a single rectangle of polymer solution wouldn't make a strong film. And you'd be right. So we passed the substrate through the printer multiple times to build up the thickness of the film. After 10 or so passes, the film becomes thick enough to peel off the substrate, as you can see in the photo. Now, why would we want to print drugs onto substrates in the first place? Well, because there are some products where it is an ideal manufacturing option. On the screen are a few examples. The most obvious are products that are medicated thin films. In the UK, we have nicotine, which contains nicotine, and Gas-X, which contains simethicone, but film strips are much more popular in the US. They are designed to be carried in a pocket or bag, and when placed on the tongue, they dissolve instantly. One issue with the manufacture of these film strips is that the polymer and drug are dissolved in a solvent and then cast in big sheets. The final production step involves cutting the film to the required size. But the act of cutting creates a stress point at the edge of the film, which can lead to crystallization of the drug, in some instances, on storage. By printing the drug onto the film, it is possible to leave blank edges where the blade cuts, so there is no risk of crystallization. On the left of the screen is a contraceptive pill. Here, the issue is different. These tablets contain a tiny dose of drug, typically 50 micrograms, and it is a huge challenge to blend the powder for compaction containing such a small fraction of drug and make sure each tablet has the required amount of drug. Using a printer, it is possible to make blank tablet cores onto which the drug is printed. In this way, the dose of each tablet can be precisely controlled. We thought we would test our printer and see how precisely it could print a drug onto a substrate. On the screen, you can see our calibration curve, and it's pretty straight. By changing the concentration of drug solution, salbutamol sulfate in this case, in the cartridge, you can see that you can change the amount of drug deposited on the substrate. You might also note the concentration on the y-axis, which is in micrograms per square centimetre. That's very small. But it does mean inkjetting has much potential for manufacturing dosage forms containing highly potent low-dose drugs. Before we break for coffee, I just want to look at a number of other potential areas of application for inkjet printing in pharmaceutical development. These are all from research papers, so you can download and read the original articles, or maybe you can find other examples. The first application is by my own PhD student. She was tasked with using inkjet printing to make particles suitable for inhalation. To do this, she mounted an inkjet printer cartridge directly over a jar containing liquid nitrogen. You can see the arrangement on the left of the screen. The print cartridge contained an aqueous solution of salbutamol sulfate. When set to print, the cartridge fired droplets of solution directly into liquid nitrogen. Being very cold, this immediately froze the particles. The student let the liquid nitrogen evaporate and then used freeze drying to remove the frozen water from the particles, leaving behind very porous particles of drug, as you can see on the right of the screen. The particles were about 50 micrometers in diameter, which would ordinarily be considered too large for inhalation, but because they are porous, they behave like much smaller particles. This is termed their aerodynamic diameter, the size of the solid particle they behave like. If you can't see why a large porous particle behaves like a much smaller solid particle in terms of its aerodynamics, think about throwing a solid ball and a sponge ball of the same size. The sponge ball will not fly through the air as fast or as far, because the air can pass through the pores, not around the surface as it does in the case of a solid ball. We tested the performance of our inkjet printed particles using a next generation impactor, which is an in vitro model of the lung. The table on the screen shows the results. Dry powder inhaler performance is characterised by the fine particle fraction, or FPF, which is the proportion of the dose that actually makes it to the deep lung. The commercial product, Cyclocaps, had an FPF of around 26%, similar to that of spray-dried salbutamol. We found that as we changed the concentration of drug in the printer, the aerodynamic performance of the particles changed. By reducing the concentration to 5% weight volume, our powders had an FPF of 24%, very close to that of the commercial product and excipient-free. The next example is by a friend of mine who works at the University of Greenwich. He used an inkjet printer to spray a coating onto metal stents, the types that are implanted to restore blood flow through coronary arteries. To get good coverage, the stents were mounted under the printhead and rotated. The coating contained anti-tissue growth factors because the main risk of failure with a stent is that the body thinks it's a foreign object and tries to cover it with cells, which has the effect of blocking the artery again. The last example before we break for tea is the use of inkjetting to build up thicker drug-loaded objects. Like we did with the polymer films I showed you earlier, here the printer makes multiple passes over the same substrate to build up objects layer by layer, very similar in principle to 3D printing, as we shall see after the break. The printer allows highly defined shapes to be fabricated, and because each has a different surface area to volume ratio, they release drugs at different rates, as you can see in the dissolution profiles. Right, it's time to stop for coffee. When we come back, we'll look at how 3D printing is revolutionising medicines. So have a bit of a break, and I'll see you in a bit.